sensory overload following a concussion, a traumatic brain injury, a stroke, a noxic brain injury. Why does that occur? That's what we're going to talk about today. If you go through Google, through YouTube, most people, when they talk about sensory overload, they're going to talk about things that you do to limit the amount of stimulation you get so you don't get overloaded. But no one actually talks about why the overload occurs to begin with, right? So they tell you to wear rose-colored glasses or different filtered glasses, wear headphones, wear earplugs, right? Avoid certain environments. But, some people, they respond better than that to others, but that's also not a way to live your life if you don't have to. So why does that occur? Now, there's a lot of overlapping themes that we see within the brain between different symptoms and conditions. So a lot of people with these brain injuries, they ultimately have bad headaches, they have migraines, and kind of the same process that occurs in migraines occurs to an extent in sensory overload, right? Because those with migraines, they tend to want things quieter. They want not as much light, right? They don't like so much stuff going on. So when we look at migraines, we need to understand this. There's what's called a resting membrane potential, okay? The resting membrane, okay, and I'll put T, resting membrane threshold, resting motor threshold, whatever you want to call it. And then I'm put FT, so this is firing threshold. So this is how much stimulation has to occur for a neuron in your brain to actually fire and activate. When we look at migraines, this number gets shifted. So imagine if this is how much stimulation it's supposed to take for a brain cell to fire, but because of things, it is shifted up. Now it doesn't take so much stimulation for it to fire. The thing is, every time your neurons fire, it takes energy. Well, why does this matter in the brain injury space? We know there's 4 big things that happens with every single concussion, brain injury, TBI, stroke. One is altered connectivity within the brain. So different neural pathways and networks get thrown off. 2 is we get mitochondrial dysfunction. 3, we get inflammatory immune system changes. Lastly, number 4, we get blood flow and vascular issues. So when you get mitochondrial issues, the neurons don't produce and use energy as well as they should. So if you have neurons, pools of neurons that at a higher threshold, and it doesn't take as much stimulation for them to fire, you're going to burn through energy faster. Now, when your energy burns through faster and your mitochondria can't keep up, they essentially do what's called uncoupling, and they're going to spill components, right? They're going to spill components that ultimately damages other mitochondria, and this is going to create inflammation. And it basically creates this loop. So this inflammation is going to drive more energy-based issues within the mitochondria through this. Now, based upon which neuron pools are having issues, you may be like, well, I have more issues with just light, or it's just sound. Because maybe it's that part of the brain, right? Temporal lobe versus occipital lobe versus parietal lobe. Now, that's part of this, but I don't want you to think that's all of it, right? So we do have to understand this. This is key. When that happens, we burn through energy. But let's explain why this matters. It's beyond just this inflammation. Inflammation is key here as well. But when you burn through energy, the brain is a self-regulating organ. So here we're going to break this in half. We're going to say this is our parasympathetic nervous system. This is our sympathetic. 90% of the cortical output goes to your brainstem. This is then going to fire down to your gut, to your spleen, right? In the spleen, you get anti-inflammatory monocytes produced, right, to quiet down inflammation. Intestinal lining, digestion, but part of it also fires up to inhibit excess sympathetic output. because it's not a all or nothing game. It's a how balanced is it at that moment. But guess what? We talk about inflammation, right? In your sympathetic part, so this is your midbrain, you have these nuclei. Okay, you got a part known as the tectum. You got an inferior colliculus, and you've got a superior colliculus. Those are responsible for visual and auditory. Now, when you get issues, now all of a sudden you get what we call a tectal response. So that's why we see a lot of people with brain injuries. They are sensitive to light and sound. So this is another component of sensory overload. Energy failure, inflammation shifts this balance. It's going to drive light and sound issues. So that's another thing. Next. Visual. Let's go into visual overload. Lots of people with brain injuries, they have anxiety. They feel anxious. But is it anxious because your brain is going too fast? That's what some think. What have I noticed? Well, I find most people actually have anxiety because their brain can't process the world around them. So if your brain's taking in all this sensory input, it's taking in all this light, it's taking in auditory information, it's taking in sensations, touch, feel, all that. If it's too much and your brain cannot filter it, it is now like you're watching a movie on 2 to 3x speed. And the thing is, our visual system is very, well, I'm going to say attacked, really, in today's world with the amount of electronics, computers, cell phones. It really gets roughed up. And so if the visual system is impaired, that alone is going to drive feeling sensory overload and those symptoms: depression, anxiety, irritability, headaches, dizziness, and everything else. And it all goes back to this. It all goes back to that at the core. And we're going to talk about how you actually would address that and work through this. But we're going through what should be considered when we look at sensory overload, right? So there's, once again, there's visual, there's auditory, there's touch. And most people, it's really a mix, right? There are some people who just have one versus the other, but it is a mix. Now, the very last thing before we talk about how you actually address this, okay? We've mentioned filtering quite a bit. So you have what's called corticothalamic loops. Corticothalamic. So basically, what happens, you've got your cortex up here, right? Sensory input comes in. It's going to come in, it's going to relay through your brainstem, specifically in a part known as your thalamus. Your thalamus is where a lot of the initial filtering occurs. And then it's going to feed up into your cortex. Now, not everything that hits the thalamus should really make its way to the cortex, because if everything did, we would live in a state of hurt. So why is it different now because you've had a brain injury compared to before? Well, it's because your cortical output isn't able to gate thalamus output. So basically stuff should come in, your frontal lobe, your parietal lobes, right? They should fire down and say, hey, thalamus, cool, let's filter that. We don't need to let it all come in. So it's like walking outside, right? And seeing the light versus you walk outside and you got sunglasses on. The person who has sunglasses, they've got that filter. Well, our brain should always have some sort of filter on visual, auditory, and once again, all of that stimulation. But when it doesn't, now you feel that sensory overload and you feel overstimulated. So hope this is making sense so far. And now we're going to go back to this and wrap it together. So I've tried to bring in some of the science behind it without going getting crazy depth, because there's some basal ganglionic stuff that we can talk about that we're not going to. So when we understand what contributes to this, it is impaired connectivity within the brain. It is mitochondria, immune system, specifically microglia cells, but even other stuff, astrocytes and stuff like that plays a role, and then peripheral immune cells. And then we'll put O2, blood flow. Now, I'm going to walk you through some patterns. Are you sensory overloaded all day, every day? Or is it like, well, you know what, for the first couple hours, I'm okay. And then it gets worse and worse. And what I notice is if I'm driving or also if I'm on my computer, that is what does it worse versus other things. Because you are going to burn through your mitochondria and your energy reserves at different rates based upon the health of those local areas within your brain. Okay, so you may have more injuries in certain parts of the brain versus the other, some networks more than others. So what's happening there matters. And this is why I don't like it when people try to say like, hey, I did hyperbaric and it didn't do anything. Well, doing hyperbaric on its own is just that. That's it. They're literally trying to make that everything. Hyperbaric on its own doesn't necessarily do a fantastic job of reconnecting the brain. Yes, it helps with this to an extent. Yes, it helps with this to an extent, and mitochondria to an extent. But it's not dynamic enough to meet the needs of what's happening. And that's assuming that you don't have any hypertension. That's assuming your nitric oxide system is healthy, right? You're able to exercise, which is also driving blood flow and oxygen. That you don't have any blood sugar issues, right? Now you're going to impaired insulin response, impaired glucose uptake, which isn't going to go well because our brain uses more energy than any other part of the body. Immune system, well, what's happening there, right? Do you have things that got unearthed? Was there infections that came unearthed? Which we know that in the research now, they were actually showing greater reactivation of different viruses with a brain injury. What if you have mold issues? Once again, what if you have blood sugar issues? What if you have anemia? Right? What if your gut microbiome is a complete mess and you think your gut's okay because you don't have diarrhea or constipation? That also is going to be a player here. What about mitochondria? Right? Once again, a lot of the things I just said fall in that category. Right? What if the foods you're eating are inflammatory? Right? The list goes on and on and on. Thyroid. What about your hormones? And then lastly, what about connectivity? What about eye movements? What about balance in your vestibular system health? What about your cervical spine? What about pre-existing depression, anxiety versus no pre-existing depression, anxiety, or pre-existing PTSD versus no pre-existing PTSD? What about prior hits to the head that already caused some remodeling of these networks? I hope you're seeing here, this is complex. This is why most people that have brain injuries and they do regular physical therapy, no offense to those physical therapists, they usually leave pretty disappointed. And it's because they're trying to make one of these things everything, right? Regular physical therapy at its best does this. At its best. What I normally see, it doesn't address most of it, right? They only do a little bit. They don't really dive into the nuances of the visual pathways of this and integrate visual system with vestibular system with the cervical spine. Those all have to be integrated. Because guess what? These all overlap. So as your connectivity improves, your mitochondrial function is going to improve. As your connectivity improves, you're also going to reduce and change your microglial response. You're going to help. That's why people talk about vagal nerve output, right? Vagus fires down to your spleen. You've got what's called alpha-7 nicotinic receptors, which is going to produce anti-inflammatory macrophages, right? When you also have good connectivity, you're going to drive more blood flow and oxygen areas. You're going to, right? But then again, your immune system is playing a role here, right? Everything plays a role. So there is no disconnecting this. Now, what you have to figure out is because at this point in time, you've got sensory overloading like, man, this is a ton. What do I even do? Well, you need to find someone who's skilled enough to work through this with you. And here's what I do to start with people with. Obviously, I'm doing a very in-depth evaluation and examination, but there's something I have people think about. It's my 5 things. What are the 5 things that, if it happens, is going to make you feel better? What are the 5 things that, if it happens, are going to make you feel worse? And we take those 5 things and we leverage it. Because if it's if I get sick, I go to crap, right? Then guess what? We know the immune system when you get sick is a big thing. Or if it's when I drive, that is really what tanks me. Or if I lose an hour of sleep or 2, that is what tanks me, right? If I get stressed, we start having to say, what are the key leverage points that we need to hit? And let's hit the ones that matter most for you so you can actually get better. And if you did supplements that actually make you feel better, great. Was it fish oils? Was it acetyl L-carnitine? Did you do NAD injections, right? There's a variety of things people are trying. And what the astute provider should be doing is when something works or doesn't work, they should be seeking to understand why something works, why it didn't work, and why it worked the way it did. Because everything is about understanding mechanisms and pathways. You understand the mechanisms and the pathways of the central nervous system. You understand the immune system, mitochondrial dysfunction. That is where even the hardest of cases are going to see results. They're going to see results. Does that mean they're going to get 100% resolution? No. But should they be in a better spot than they were if all of this is done? Yes. So hope this made sense. I'm Dr. Zimmerman. I've been helping people with concussions for over a decade now, and it's really my life's mission to make sure people understand what these brain injuries are and to stay at the forefront of the research and the clinical things that can be applied. And once again, as I've seen, it's not just one thing. Those that try to make this really too simplistic and try to be like, oh, here's the one modality that does it for everyone, they usually have an insanely high failure rate. They do. It doesn't mean they don't help people, because there are some people where, hey, look, that's all they needed, right? There are people who literally get something done and like, whoa, that was amazing. But then they tell all these other people about it, like, man, but I didn't get better. And they start thinking there's something effective about them. It's like, no, man, they got lucky that that's the one thing they needed. And they felt better versus you can have multiple things going on. And that's why there's the 4 things that happen in every single brain injury. The only difference is how much does it play a role for each person compared to the other person. So hope you found this useful. I'm Dr. Z.